I'll come back to today's topic, which is evolution of doctor-patient relationship. And we ourselves over the last 30, 40 years have actually seen evolution of this relationship. And I have actually seen when, people used to say, that's my doctor, that's my family physician. And today people in India, in a country like India, they are saying, he's my medical consultant. So from being a family doctor, we have actually moved over to being a medical consultant or a clinical consultant to public. So, there is a lot of distrust which has happened, and there are many angles to it. I'd like you to share your thought process why this happened in last 2-3 decades.
I think the challenge is, Sachinji, I think the challenge is that many people want more at less. So if I have to, I'll give you a simple example. Suppose I want to travel by an airline. If you tell me what airline do you like, I'll say Vistara. Then you'll ask me what sort of Vistara amenities do you like? I'll say business. I'll say I want to fly Vistara business. Then you'll ask me how much do you want to pay? I'll say I want to pay SpiceJet rates, or even worse, I want to pay AC rates of the train. The two cannot go hand in hand. The important thing to remember is that patients need to decide whether they want to be patients or they want to be consumers. You can't turn around and want to be a consumer when it suits you and want to be a patient when it suits you. So as a result of which, if you ask patients, what do you want? Say, nay, doctors and hospitals are very loosely or very badly run. We want better AC rooms, better suites, etc. You want a better suite, but you don't want to pay for the surgery cost. That cannot happen in any part of the world. I mean, it is impossible to happen even in the developed countries. Even in the developed countries, if we look at healthcare, the Western countries, which are at the top of the helm in terms of GDP, etc., are also struggling with this we want more at less cost sort of scenario. If you look at insurance run setups or you look at government run setups like the NHS, the problems are the same everywhere. So I think patients need to first of all decide, are you a patient or are you a consumer? If you're a consumer, then no problem. You put me, the doctor, under a Consumer Protection Act, in which case you go ahead and treat me like any other professional. But if you treat me like any other professional, don't expect me to do philanthropic work. ना कि ये कि you go ahead and expect me to pay commercial taxes when it suits you, to be part of the CPA and to be considered a trader under the CPA Act, because the CPA only considers traders. So doctors, you put under the traders community. And then when the time suits you, then you go ahead and you say, let's go ahead and make sure that doctors go into the forefront for COVID, and we will not even give them PPEs. And if they die, then they should consider it as a service, just like a soldier. So you make up your mind whether you consider our profession a profession, you consider it a vocation, you consider it a trader, a trading activity, or you consider it a corporate activity. But don't change the goalposts at all periods of time. जब मन किया तो you make me God, जब मन किया you make me dog. This is not appropriate. मान लो कि you consider me dog, then let me be dog at every point in time. Then you handle yourself during COVID. Don't turn around and then beat plates and expect that I will go in and die like a dog, like a god for you. So I think this is this discrimination or this changing goalpost which has to change. I am okay as a doctor being called a medical consultant. But if you want to call me a medical consultant, sure, expect me to deal with you in that manner. I am okay as a doctor to be taken under the CPA, sure, no problem. But if you take me as a CPA under the CPA and consider me a trader, then don't expect philanthropic service from me. You don't expect philanthropic service from a chartered accountant. You don't expect philanthropic service from your Kirana store. Why then are you expecting philanthropic service from us as doctors? So make up your mind whether I'm a medical consultant or I'm a doctor, because it's very difficult for us to be different things to different people all in the space of one day.
Okay. So that's actually very right, whatever you said. And I think, this is very true that patient expectations have, risen too many over the last few years. While we are talking about India and Indian patients, actually, since you are also visiting faculty at MD Anderson Cancer Center in US, so what is difference between expectations of Indian patients versus difference between patients in US? So can you elaborate on that?
I think I'd like to use an analogy for that. Sachin ji, at our stage, we are probably a crossover generation in India in many ways, right? Crossover in which ways? Crossover in the way, suppose for instance, you might be or I might be helping our wife slightly in the kitchen, right? But our children will probably do a far better job of that because they will have grown up in a society where gender equality will be the norm rather than the exception.
Right.
And so they will probably they will be expected to cook. Even the sons will be expected to cook. So we are the crossover generation there. We are a little bit on this side also like our fathers, and we are a little bit on that side also like our children. Similarly, India is also in a crossover for healthcare. We want to have all the benefits and all the services which America has, without realizing that American healthcare, in my humble opinion, is a failing system, if not an already failed system. We have to understand, one of my friends, he was a director in Accenture, and his wife was having a complicated delivery in New Jersey. This is approximately 3 years ago. And the cost that insurance had to pay for that cesarean section was a small amount of 280,000 US dollars, which if we translate it in Indian rupees today at 75, it's basically about 2 crore rupees plus. Now, 2 crore rupees plus for a delivery. Do we really want that system? And also, do we want a situation where society becomes so litigation friendly that people are first thinking about tests not because the patient needs it, but because they want to save their own skins and own backs? In fact, funnily enough, or not so funnily enough also, most of the new FDA trials which are coming out for skin growth factors or for hair growth or for any of the new devices are coming out of Europe or East Asian countries like Japan, etc. Because the US FDA is finding it increasingly difficult because of the litigational circumstances which exist in the country to go ahead and actually drive innovation. So there are advantages that India has. Our problem is that we sometimes do not see the big advantages that India has. India is a great country and we have massive advantages. The fact that we are able to deliver healthcare, the fact that even in cosmetic surgery, my chosen specialty, the cost of a surgery is approximately 1/8 the cost of the same surgery in Thailand. And I'm talking about Thailand. I'm not even comparing it with the United States. So therefore, I think we have lots of positives. We should hang on to our positives. We should guard fiercely against the fact that we should not let our system get Americanized to such a situation that we actually have problems with the system and we actually end up being in the same problems and the situation which the Americans find themselves in 20 years. We don't want to reach there, honestly. So therefore, I think we should try always to be the best India we can be instead of being a poor America that we are at this moment trying to be.
Great. So that was very insightful, Dr. Debraj.